All right, folks, let's move on to chapter 5 now, the states of consciousness. Now, this is very, well, as usual, even for almost everything we do here in Intro Psych, it's very topical. And this is as well, the so-called states of consciousness, and just talk about first just what is consciousness? Just what is it? It's your sensations and perceptions, and we just talked about that in the last chapter, sensations and perceptions of external events and your self-awareness of mental events, including thoughts, memories, feelings about your experiences and yourself. Waking consciousness, normal, clear, alert awareness. You're right now, or maybe not so much while you're listening to me babble on about consciousness, but at any rate, perhaps I am affecting your or altering your state of consciousness. An altered state of consciousness is a changes that occur in the quality of pattern of mental activity, and it's different from waking consciousness. Some of these altered states we can feel either as subjective qualities, and we can measure them as well. We can measure them both using autonomic or biofeedback equipment, that is measuring your blood pressure and heart rate and your skin resistivity. It's called galvanic skin response or electrodermal response sometimes. Very much like a polygraph or a lie detector, only not directed toward whether you're lying or not, but rather your internal state. So we can actually measure your internal state relative to your autonomic nervous system, and we can measure your internal state of consciousness also with something called electroencephalography, and we'll talk about that pretty soon as well. So states of consciousness is a very varied topic. We see here in the center states of consciousness. What do we have? Well, we have a sleep state, and under a sleep state, you have, REM and circadian rhythms, also disorders. Hypnosis we'll talk about, waking consciousness, and then also there's drug-altered consciousness, stimulants, hallucinogens, depressants, any other kind of substance abuse. We'll talk about states of consciousness also relative to meditation and hypnosis as well. So, one of the major states of altered consciousness is our state of sleep. So sleep, though, is a state of altered consciousness, and we need it. We must have it. It is an imperative that we sleep. It's an innate biological rhythm that can never be entirely ignored. There are theories about sleep, some theories, and of course these theories become more and more accurate as we do more and more research. The repair or restorative theories about sleep say that lowering the body and brain activity and metabolism during sleep may help conserve energy and lengthen life. Sleep deprivation, which probably we've all experienced at one time or another, maybe even now. With few exceptions, 4 days or more without sleep really becomes hell. It's something that is almost impossible to do, and I've tried it myself in traveling, for example, overseas, where the time can shift as much as 12 hours or more. And so when you get there, you need to stay awake and stay awake longer and longer. And just that is very, very difficult. I'm sure any of you who have had graveyard shift duty, where you have to stay up all night long to work, getting into that mode also. You've probably got some experiences and stories relative to that as well. If you look at the graphic here, you could see that that sleep is essential to our health and well-being. Look, we spend, even if you only get 6 hours of sleep a day, that's still 25% of your time. Without sleep, diabetes risk goes up. Risks of some cancers may increase. Stroke risk quadruples. You're more likely to have an accident. Uh, uh, there is some evidence of loss of brain tissue. You're more likely to catch a cold, obviously, because your immune system is also down. Heart disease risk increases as well. Sleep is very, very important to our health and well being. Okay, let's discuss some of the disorders of sleep. Hypersomnia, in other words, hyper means above, like a hypersonic airplane is one that goes faster than sound. So hyper means over. And excessive daytime sleepiness arises after a few hours of sleep loss. So, of course, if you're sleepy or you've lost a lot of sleep, you will experience some hypersomnia. A day or more of sleep deprivation can lead to microsleeps as well. Now, microsleeps are very dangerous driving, and then because a microsleep can last for a second, 2, 3 seconds, and you may have experienced this. You're behind the wheel, and you're driving, and you're tired, and all of a sudden you jump, and you don't even remember how you got to where you are, but you're still driving along. And only 2 or 3 seconds went by, but you literally had a little micro sleep there and lost awareness at that time. If you go to sleep for or have a very, very, very long time without sleep, you will experience sleep deprivation psychosis. And we can talk about this more later as well when we talk about conscious altering drugs. So more than a day of sleep deprivation, and I would say even 3 or 4 days can cause a sleep deprivation psychosis. Literally, you will hallucinate. This often occurs when one uses drugs also to stay awake, for example, amphetamine. So like I said, we'll talk about that later. I just mentioned microsleep. It's a brief shift in brain activity to normal pattern, and that's not good when you're driving. Sleep deprivation psychosis. Like I said, you will experience delusions and hallucinations if that kind of sleep deprivation has occurred. What are some sleep patterns? Sleep patterns. They are daily rhythms of sleep and awakening. We have a pattern. We have a cycle, a sleep cycle. Most adults sleep 7, 8 hours a night. Obviously, some sleep less, some sleep more. Older people seem to have require less sleep than younger people. And I mentioned earlier EEG and brain waves, electroencephalography. Electroencephalography or an electroencephalograph is a brainwave machine, and it amplifies and records electrical activity in your brain. Now, this electrical activity, has a very, very low voltage, so it's very difficult to pick up. So this electrical activity is picked up basically with electrodes, little electrodes. There's 10 on each side of your scalp, and you wear a little hat that holds it in place. And the various parts of your brain, and actually it's just the upper part of your brain, your cerebrum, that emits these very small voltages, and we can see through electroencephalography how one cycles, not in wakefulness and in sleep, and in through the different types of sleep as well. You can see here on the slide that that brain waves are categorized into 4, actually even 5 categories. So delta being a very slow wave brain wave, it's called deep sleep. Then sleeping is theta, that's from 4 to 7 hertz. Hertz means cycle per second. Awake or resting is alpha, and 8 to 13 hertz it says awake and resting, which means basically that you're relaxed in this state. You're awake, but you're relaxed, and this is the sort of a state that we aim to get to when we do meditation, which we'll also talk about later. But beta, awake with mental activity, and that's 14 to 30 hertz. And then, in fact, there is even a higher level that isn't shown here. It's called gamma, and gamma can go up to 125, 150 hertz, very high brainwave activity associated with deep concentration and mental activity. So the stages of sleep, and we do go through stages of sleep. When you first sleep, light sleep, muscle activity slows down. You have maybe some occasional muscle twitching. So this is where you're falling into sleep. 45 to 50% of your sleep, however, is this breathing pattern. Heart rate slows, slight decrease in body temperature as well. Notice in the slide that she has electrodes attached to her skull, and in fact, she's sleeping in a sleep lab. Many times, if you have some sleep problem or if you have sleep apnea or some other issue going on, sometimes you have to go to a sleep lab and sleep there, monitored with these electrodes, and just sleep there in the sleep lab, and then you're monitored all night. In stage 3, deep sleep begins. Your brain begins to generate very slow delta waves. So remember those deltas there. That's on the bottom. Then we go into a very deep rhythmic breathing, limited muscle activity. Brain produces more delta, and then we go into an area, very important area of sleep, stage 5, which is called REM, or rapid eye movement. So then your brainwaves speed up, dreaming occurs, your muscles relax. They not only relax, you're paralyzed. Most of us are paralyzed during REM. And the reason for that is this is when most of our dreaming occurs during REM. And so if you're dreaming about falling or running or swimming or doing whatever in the dream, you certainly want your muscles basically paralyzed so you're not actually doing it. Now, there are some disorders where the muscles aren't necessarily paralyzed, and we'll talk about those two different types of sleepwalking and that sort of thing. Okay, now there are several hypotheses regarding sleep. The two basic states of sleep are non-REM, so no rapid eye, non-REM, non-rapid eye movement sleep, and rapid eye movement sleep. So the dual hypothesis of sleep says that REM and non-REM sleep help refresh the brain and also helps to restore memories. What is the function then of non-REM sleep? Non-REM sleep was stages 1 through 4. So this occurs during 1 through 4, and there's no rapid eye movements. About 90% of non-REM sleep is dream-free. REM sleep is associated with dreams. The delta wave or slow wave sleep early in the night brings on an overall brain activation level back down, and it also allows a fresh approach to the next day. What's the function of REM sleep? Notice there in the diagram you see the depiction. There actually is a model, and you see his eyes are moving back and forth. And this is indeed what happens during REM sleep. You can, when one is undergoing rapid eye movement, there is a very large probability that a dream is occurring at that time. Now, whether you remember it or not is yet another issue. People who do different types of sleep analysis and dream analysis will often want to be awakened and immediately upon this in order to recount the dream. However, I should also tell you that a form of I'll use the word torture that use with brainwashing techniques and to question um, captured people that you want information from, is to not don't pull their fingernails out, don't waterboard them. Instead, just wake them up every time they go into REM sleep. Only REM sleep. So you're watching them, and then as they go into REM sleep, you wake them up. And then as soon as they go back to sleep, let them sleep. Soon as they go into REM sleep, you wake them up. After a period of that, you will indeed. That is not only torturous, but after a period of time, it also will produce a psychosis, literally a form of a psychosis. Now, insomnia, as you probably all know, is difficulty in getting to sleep, and but it also includes frequent nighttime wakenings, like you may go to sleep, but then you wake up at night, or you wake up too early. Now, insomnia is also associated with a lot of other things. So, insomnia by itself actually is fairly rare. Insomnia is more associated with alcohol, with drinking, because in fact we think that alcohol relaxes you and knocks you out, but in fact the rebound of it, or once it starts to wear off, is metabolized. There's a rebound effect, and then you then kick in from a depressive state to an anxious state. So alcohol has a definite influence on insomnia. Depression as well. So depression also will cause insomnia. High anxiety, general anxiety disorder will also cause insomnia. And stress in general causes insomnia. Temporary insomnia is just due to a brief period of sleeplessness. And again, worry, stress, excitement. Here's the thing about insomnia. Don't fight it. Get up and do something else. Then return to bed when you're no longer struggling to stay awake. But here, do not stay in bed and struggle to sleep. Or do anything else for that matter. Get up, because if you continue to do that, you will now associate the bed with wakefulness, with insomnia, with not being able to sleep. So you don't want the bed or where you sleep associated with the negative aspect of insomnia. So don't just lay in bed and fret and roll around, and in fact don't lay there and eat or anything else for that matter. Get up and read or do something else. Chronic insomnia exists if sleeping troubles last for more than 3 weeks. A regular schedule, going to bed at the same time each night, is important. Like I said, if you find yourself tossing and turning, don't fight it. Just get up. Sleeping pills exacerbate insomnia. They will increase make your insomnia worse after a period of time. They also cause a decrease in REM and may very well cause dependency. They're way too easy to get into. Drug dependency insomnia follows any kind of withdrawal from sleeping pills. So if you've used sleeping pills for any period of time, and then try to not use them, you will experience a sleeplessness that is worse than the sleeplessness that you experienced before you started using them. What are some behavioral remedies for insomnia? Well, stimulus control is one, linking a particular response with a particular stimuli. This is straight behaviorism, and in that way you establish a regular sleep pattern. Sleep restriction, or in other words, restricting sleep to normal sleeping hours. So no matter how tired you are, or no matter how active you are, you always set a time or a period of time for you to sleep, and that's the only time in which you can sleep. If over that period of time you get up anyway. There's something also called paradoxical intention, which is an interesting therapy for sleeplessness, and that is try to stay awake as long as possible. Don't go to bed. Just stay awake and see how that works. And then, of course, there's just simple relaxation, the use of physical or mental relaxation strategies before you go to sleep. Exercise, strenuous exercise earlier in the day promotes sleep as well. Now, if you do that late at night, thinking that, oh, I'm going to tire myself out at night and go to sleep, no, because now you're cranking up your metabolism, and that may not work as well as you believe it would work. Food intake, eating starchy foods containing tryptophan. And now tryptophan is amino acids like in bananas as well, or in turkey. That's what it is, turkey. Turkey's filled with tryptophan. It's an amino acid, so it increases serotonin levels and therefore leads to sleepiness. Now, and avoid stimulants like coffee and cigarettes and colas and things like that. Definitely avoid those. If you're drinking coffee first thing in the morning and you find that if you stop drinking coffee after a while, that you sleep better, then maybe it's the coffee, or maybe you have to stop drinking any kind of stimulants by a certain time of day. Let's say by noon or 2 o'clock or something before you go to bed. But these are things you might want to experiment around with as well. Some sleep disturbances, sleepwalking, sleep talking, and sleep sex. Sleepwalking or somnambulism occurs in non-REM sleep during stages 3 and 4. Sleep talking, speaking while asleep, occurs in non-REM sleep as well. And many behaviors like sleep sex can also occur during non-REM sleep. And I've got it here, sleep sex, because sexsomnia it was used as a defense to criminal charges, and can be used as a defense to criminal charges as well. I think it's a flaky one, but nevertheless, it is used. If someone's sleepwalking, don't try to communicate with them. It's pointless. The same also as if they are like a child, especially experiencing night terrors. It's not dangerous to wake them because they're just like a normal. They're just asleep, and it's always better to wake them so that they don't wander off and hurt themselves. So you can wake a sleepwalker. Nightmares are obviously bad dreams, and they do occur during REM sleep. Night terrors are panic and hallucinations, and they occur during stage 4 non-REM sleep, and they're most common in childhood. Sometimes they occur in adults, but they're very, very common in childhood. If you've ever seen this or experienced it, the child is sitting up, looks straight awake, and is panicked or in terror, and is completely unaware of your presence. Imagery rehearsal. Mentally rehearse the changed dream before you go to sleep again, and it may help eliminate nightmares. Sleep apnea. Now, sleep apnea can be dangerous because there's an interruption in breathing during your sleep. It produces loud snoring and then short silences and gasps for breath. So certainly also anybody who is near you at night can also be greatly disturbed by this loud snoring. Sleep apnea, however, can be treated by surgery and weight loss and continuous positive airway pressure. And you may have seen these positive airway pressure masks that people wear in order to get rid of that. But there's the sleep apnea symptom is a cycle. It's a snoring and dry mouth, and then it can go to memory loss and attention deficit, and depression and fatigue and nocturia and impotence and insomnia, and then it's not a good thing. So it's better to get that treated, and it is readily treatable. Sudden infant death syndrome, or crib death, is an unexplained death of a healthy infant. It may be related to sleep apnea. Uh, uh, it may be due to some sort of a weak arousal reflex, so that as the child, as the infant, sleeps and may in fact have a sleep apnea, there has to also be an arousal to get that breath back, and it may not be it may not be fully developed in the infant. Infants should always sleep on their back to try to prevent it. Remember, back to sleep. Do not put infants on their bellies to sleep on the back. Another type of sleep disturbance is called narcolepsy, and it is a sudden, irresistible sleep attack. Sometimes this disorder is even used in comedies. What is that? There was a movie called Rat Race a few years ago, and the guy that plays Mr. Bean had narcolepsy, and all of a sudden he'd stop wherever he was and just fall asleep. But it's a sudden, irresistible sleep attack. One may also suffer from catalepsy, and that is a sudden temporary muscle paralysis, and it leads to complete body collapse. So not only is there narcolepsy, but also catalepsy, where you're just collapsed. Boom, you're a jellyfish all of a sudden, and then you fall directly into REM sleep. So what is the importance of REM sleep? And I have emphasized this before, and I threw that graphic back in here, there where you see the eye going back and forth under the eyelid. REM rebound is the occurrence of extra REM sleep following REM sleep deprivation. And REM, in fact, is the one stage of sleep where there is where one needs to make that up, so you get this rebound effect. As you can see here, and we've gone through this before earlier, the various stages of sleep, going stage 5 REM and then back into stage 1. But REM is very, very important. Now, I'm sure that we've all heard about dream theories and what a dream really is or means. The psychodynamic theory emphasized internal conflicts and unconscious forces creating dreams. There was the idea, Freudian idea of wish fulfillment, that dreams are expressions of unconscious desires. People like Carl Jung, as well as Freud, said that images in dreams or dream symbols have deeper symbolic meaning. In fact, that's a fairly common notion across many cultures around the globe. Also, that there's a manifest content or obvious, visible meaning of a dream, and then latent content. And this is something that Freud and Jung and many other dream theorists believed, is that there's latent content, hidden symbolic meaning of the dream. How do we explain dreams today? Well, let's talk about the activation synthesis hypothesis, and that is, there's a random activity in the lower brain centers that result in manufacture of relatively bizarre, meaningless dreams by the higher brain centers. So your higher brain centers put language and images and associate memories for you as you sleep. Those higher brain centers relax, but your lower brain center still remains active. It's got to keep you breathing. It's got to keep your body temperature up. It's got to keep your heart rate going, and so on. So there's this neural energy may very well be how. When your fairly relaxed cerebrum at night sees this, it may be how a dream may be how your cerebrum interprets that activity from your lower brain. The activation synthesis hypothesis. Now, the neurocognitive dream theory is that dreams reflect everyday working thoughts and emotions. We've also heard a lot about hypnosis, and there's a lot of mythology and bad information out there about hypnosis. Hypnosis is, and I say here, altered state of consciousness, but some say it isn't really an altered state of consciousness. We'll talk about that. An altered state of consciousness characterized by intensely narrowed attention and increased openness to suggestion. Franz Mesmer, you've heard the word mesmerize. It's named after Franz Mesmer, believed he could cure diseases by passing magnets over one's body. Then James Braid coined the term hypnosis, meaning sleep. So the state theories say that hypnosis is an altered state of consciousness. Ernest Hilgard proposed that hypnosis is a dissociative state. Also, there's the hidden observer hypothesis, and that is a detached part of the hypnotized person's awareness that silently observes events. Sort of an observer that detaches from you and looks away. No. The non-state theory says that hypnosis really isn't a distinct state. It's a blend of conformity, relaxation, imagination, obedience, and role-playing. So what are the realities of hypnosis? First of all, people have to cooperate to be hypnotized. You cannot be hypnotized if you're not cooperating to be hypnotized. There's what we call the basic suggestion effect. That is the tendency of hypnotized people to carry out suggested actions as though they were involuntary. Hypnotic susceptibility is how easily a person can be hypnotized. Here's what hypnosis can and cannot do. Hypnosis can, in some ways, increase memory, in some ways, no. It can produce brief amnesia, and I'm speaking to this with a very large body of evidence and research behind these statements as well. It can produce brief amnesia. It can reduce pain. It can produce sensory changes. It can get people to relax and make better progress in their therapy, if in fact the purpose is to make better progress in psychotherapy. Hypnosis cannot produce acts of superhuman strength, cannot produce true age regression, and cannot force you to do things against your will. Okay? Those three things cannot do. Okay, then there's meditation. Remember, we're talking about states of consciousness and altered states of consciousness. So meditation is another altered state of consciousness. It's a mental exercise for producing relaxation or heightened awareness. There is a relaxation response to exercise, and it's an innate physiological pattern that opposes your body's fight or flight mechanism, because we're always under that tension, that stress of fight or flight, fight or flight. So relaxation is removing that mechanism that is continuing, or not removing it necessarily, but certainly attenuating it somewhat. What are some forms of meditation? There's concentrative meditation, where you attend to a single focal point, object, or thought, or your own breathing. So you remember, somebody will give you what's that called, a mantra, and then you have your own mantra, and you say that over and over and over again, and that's what you concentrate on. We've gotten into an area also called mindfulness meditation, and this actually is has turned out to be a form of cognitive therapy as well. And this is based on widening your attention to become, and I say, non-judgmentally aware of everything experienced at any given moment. But non-judgmentally aware means that whatever happens around us, there may be there's some reaction to it, and that reaction is usually a positive or negative reaction. Now, it may be a very small positive or negative reaction, but yet still it is a positive or negative reaction. And anytime we place positive or negative on an experience or perception, we're judging it. Unless, of course, if it's painful, then it's not. It's clear. But mindfulness meditation is based on widening attention to become non-judgmentally aware of everything experienced at any given moment. At any given moment. So within that mindfulness meditation, we start by we savor our meals. We breathe. We just breathe. We stop and watch and observe and visualize thoughts. Just don't let a string of thoughts or text messages go through your head. Think, visualize them. What do they look like? Here's actually, this is one of my first areas of research in clinical psychology is sensory deprivation and using sensory deprivation tanks. Sensory deprivation is any major reduction in the amount or variety of sensory stimulation. What are its benefits? It can produce sensory enhancement after you're out, relaxation and changing your habits. Some of the so-called the therapy rest, in other words, which is a good name for sensory deprivation, restricted environmental stimulation therapy. But what does it do? You're in a tank of water that's your body temperature, so you don't feel any variations in temperature whatsoever. It's very still, so you also don't feel any ripples. You don't feel any changes in texture in your skin. It's completely dark, so there's no visual input. It's completely soundproof, so there's no auditory input. There's obviously nothing. You're not tasting anything. You're not feeling anything, or feeling very little in there as well. And you're not smelling anything. So the sensory deprivation of the five senses that we know, plus your vestibular system, that is your sense of direction, they're all restricted, considerably restricted. What happens in that state if you're in there for too long is that your brain provides you with all of your perceptions, everything. If your brain decodes what's coming in from outside and gives it to you in what we see as reality. If your brain doesn't have anything decode from the outside world, doesn't have any data coming from your eyes and your occipital lobes and your temporal lobes, has no information coming in, then it's going to start to make information. Then it's going to start to make reality for you. And so after a while, you will start hallucinating in there and hearing things and seeing things and whatever. So it takes some time to get used to it. Something called positive psychology or mindfulness, and this also requires some mindfulness meditation. It's an open, non-judgmental awareness of current experiences. And mindfulness is associated with self-knowledge and well-being, and like I said, also with meditation. So in this sense, in the present, are you looking at your past? Are you looking at your future? Just stay in your present. Basically, if you were looking at your past, you're looking at issues over which you may be guilty or shameful about it. And if you're looking at the future, you can't tell the future. You don't know what's going to happen. That is anxiety creating. So you create anxiety through worry and proposing a future that you can't really predict. And the past is the past. It's gone. Drop it. Now we get into drug-altered states of consciousness using psychoactive drugs. But now I think psychoactive drugs for a lot of the drugs that one takes for recreation, psychoactive is redundant. It is that's the reason it's taken. It's a substance capable of altering attention or judgment or memory or time sense or self-control or emotions or perceptions or all of the above. So what are some types of psychoactive drugs? Stimulants are probably the ones that we're most associated with, like coffee and cigarettes and chocolate, even as a stimulant. There are some stronger stimulants that may, in fact, are not so much they're stimulants. Certainly, they stimulate, but they even mimic your sympathetic nervous system. We call these sympathomimetic drugs like amphetamines or cocaine. We'll get into that later. Then there are depressant stimulants. These are substances that decrease your activity in your body and nervous system, like tranquilizers or alcohol. Now, any and all of these substances can create a physical dependence. What is a physical dependence? What is the physiological definition of addiction? That is, we experience both tolerance and withdrawal. What is withdrawal? Withdrawal is a very uncomfortable effect that comes about as the effects of the drug are wearing down. That is, as the drug is being excreted from your body and metabolized by your liver. As these effects are now coming down, we see what is called a rebound effect. So if the drug depressed your nervous system, the rebound effect is an anxious or activated nervous system. If the drug initially activated your nervous system, then we'll see a rebound effect. We'll see listlessness and depression from that. Drug tolerance is a reduction in your body's response to the drug, or in other words, you need more and more of the drug over a period of time in order to produce the same subjective effect. So last year maybe a six-pack of beer would get you high or drunk even. And this year, you need 2 six-packs, that sort of thing. So there's this tolerance. You need more and more and more in order to get the same subjective effect. Now, we say that there are 3 components to any addiction. First of all is withdrawal tolerance, and the third is psychological dependence. And that is the use of that there's a belief that the use of the drug is necessary to maintain a comfort or well-being or performance even. So what do we have? What are some patterns of drug abuse? What do we see if one has a predilection to drug abuse? Well, it starts out, usually we see it experimental, so there's a short-term use based upon curiosity. There may be social, recreational, occasional social use for pleasure or relaxation. Now, when I say drug abuse, this doesn't necessarily mean illegal drugs either. Alcohol is very much a drug. So somebody can experiment with it. Certainly, it is the most popular social recreational drug. Situational, and there's use the drug can be used to cope with a specific problem, like needing to stay awake or feeling very stressed. Then there's intensive abuse, and that is use, daily use with elements of dependence, which moves on to compulsive use, intense use, and extreme dependence. However, where we find where there's smoke, there's fire, and usually where we see one drug addiction, we usually see multiple drug addictions, and what we call polydrug abuse. And in that, within that, then we see drug interactions. So when they're mixed, one drug will enhance the effect of another. And this interaction it's responsible for thousands of fatalities every year, But you can see that many people will mix alcohol, for example, and that's one of the, like I said, the primary recreational drug. Mix it with cocaine and opiates and barbiturates and hallucinogens, of course, cannabis as well. Okay, so what are stimulants or uppers? Amphetamines are synthetic stimulants that excite our central nervous system, and specifically our sympathetic nervous system. And some of these include dexedrine and methamphetamine and meth. Let's see, what was this? Oh yeah, benzedrine. Those were truckers' uppers. Then there are so-called study drugs, which take amphetamines normally used to treat attention deficit disorder and improve physical and mental performance, like Adderall and Ritalin. And Adderall is as much of an amphetamine as meth is. Amphetamine's long-term effects can eventually lead to death. But if one abuses amphetamines over a very long period of time, one will produce you're going to possibly produce psychosis, involuntary muscle spasms, skin abscesses, sexual dysfunctions. The list goes on and on. Here I've got, I think this is an interesting graphic. You can see large doses can cause somnolence, nausea, vomiting, high blood pressure, fatal heart attacks, disabling strokes, psychosis. Here's somebody who starts using or smoking meth, starting here over a 10-year period of time. You see her in 10 years. I think this is every year, once a year, all the way over to here. Series of photos going clockwise. So cocaine is another so-called stimulant, and actually, like I said, it's considered a stimulant because it stimulates, but really it is a sympathomimetic drug in that it mimics the sympathetic nervous system. Cocaine is derived from leaves of the coca plant. From 1886 to 1906, Coca-Cola did indeed have cocaine in it. Cocaine is a highly, highly, highly addictive drug. Earlier I said that during withdrawal we experience a rebound effect. So if the drug was enhancing your central nervous system, you'll see a drop in it. And here where it says anhedonia in the lower left side of the screen, anhedonia, ability to feel pleasure. And indeed, one feels a great pleasure and excitement and a considerable amount of high self-esteem, an ecstasy when one takes cocaine. So after a period of time and feeling that, then as one comes down on that, anhedonia sets in, and just the opposite occurs. There's no pleasure, and it's very, very common after a cocaine withdrawal. MDSA or MDMA, that is, or ecstasy, is very chemically similar to amphetamines, and in fact, it was one of the first so-called designer drugs. And it's created by just small variations in amphetamine's molecular structure. It can cause severe liver damage, fatal heat exhaustion. Repeated uses damages serotonergic brain cells. Serotonergic brain cells are brain cells that respond to the neurotransmitter serotonin. So repeated use of MDMA will damage some serotonergic brain cells. I've got here gurning. Gurning is studies in rats have shown that the release of serotonin after MDMA inhibits protective jaw opening reflexes, which usually serve to prevent clenching and teeth grinding. Caffeine, of course, we all know and love this drug, and it is a drug. It is the most frequently used psychoactive drug in North America, and it is in colas, coffee, chocolate, tea. It can cause tremors, sweating, talkativeness, tinnitus. Tinnitus is hearing a ringing in your ears, suppressing. It suppresses fatigue and increases alertness. So I've got here the caffeine content in various beverages. here. For example, 1 ounce espresso, instant 8-ounce coffee, an energy drink's about 80 milligrams. Drip coffee, 8 ounces of drip coffee is 100 milligrams. It looks like it's about the strongest right there. Caffeine abuse, and I've known some to abuse it. Like they just got to stay awake, and they didn't, and they haven't discovered amphetamines, fortunately for them. Caffeineism is the physiological dependence on caffeine. Its symptoms are, of course, insomnia, irritability, loss of appetite, chills, racing heart, elevated temperature. Certainly hazardous to pregnant women if used excessively. Of course, anything used excessively, especially if somebody is pregnant, may cause birth defects. Then we get to nicotine. Nicotine is one of the is a stimulant as well. It is a natural stimulant found in tobacco mainly. It in large doses. And nicotine, by the way, I want to point this out, is highly toxic. In large doses, it causes stomach pain, vomiting, diarrhea, confusion, tremors. It is very, very addictive. Smoking is one cause, a major cause, one cause of lung cancer. It kills, and so does chewing tobacco. Secondhand smoke also endanger the health of nearby non-smokers. On the lower left side of the screen, it says nicotine reaches your brain within 10 seconds. Well, look, anything that you take into your lungs, i.e. a pulmonary intake, gets to your brain very, very quickly. It, in fact, taking anything into your lungs, smoking it or inhaling it, is the fastest way to get something to your brain, other than putting it straight into your brain. So you can read some of the side effects of nicotine there, but it affects your entire body, all the way from your circulation to your gastrointestinal system and your heart and muscular and lungs, central nervous system, everything, absolutely everything. Downers or depressants, for example, barbiturates. These are sedative drugs. They're not really used a lot. They used to be used a lot more, but they depress brain activity. There used to be you get a lot of overdoses on Seconal or Nembutal, drugs that were also taken purposefully for self-harm. Suicide, Seconal and Nembutal, barbiturates. Gamma hydroxybutirates are drugs that relax and sedate. And get this, it is a mix of degreasing solvents and drain cleaner. They do have sedative effects. It may result in nausea, loss of muscle control, sleep, or unconsciousness. I would say unconsciousness for sure, going all the way to death. Also, these drugs inhibit your gag reflex, so some choke to death on their own vomit. Tranquilizers, a lot of these tranquilizers we call benzodiazepines. So they are drugs that lower your anxiety and reduce tension. They include Valium, Xanax, Halcyon, Librium. The others would be Ativan, lorazepam, some of those others. Then there's something called Rufinol. You may have all heard of Rufinol. This is related to Valium in that it lowers inhibition and produces relaxation and intoxication. The thing about Rufinol is that it's colorless and tasteless. And therefore it can be has been used mostly as a date rape drug because it is odorless and tasteless, and they're called roofies. And now we get to alcohol, probably the most popular of the recreational drugs to most people. Not every. I mean, as things start to relax. And laws start to relax. There may be more people who prefer marijuana over alcohol or something like that. But alcohol is indeed the most common legal mind-altering drug. and it is also among the most dangerous of the drugs that is in fact not really controlled and totally illegal. The word intoxication, if you think of that word intoxication, well, toxic's in there. And intoxicating, toxic means poison. So it is the intoxicating element in fermented and distilled liquors. Alcohol is a depressant, not a stimulant. People think it's a stimulant because it lowers inhibitions, but it is very much a depressant. It is a central nervous system and motor depressant, both. Alcohol myopia is short-sighted thinking and perception that occurs during alcohol intoxication. So what is a drink? And I've got there a can of beer, 12-ounce can of beer, or a 5-ounce glass of wine, or a 1.5-ounce jigger of bourbon or something there. And they are all equal to about 0.02 blood alcohol level. 0.02. So essentially, if you look at any one of those drinks and they are equal approximately 0.02, then I know within the state of California the legal intoxication level is 0.08. So technically, if you had 4 of those, you'd be at 0.08 blood alcohol level, but that doesn't mean that everybody responds both cognitively and muscularly in the same way at 0.08. Some at 0.08 may feel perfectly sober, and others may be unconscious. That all depends. But whatever you are, 0.08 is illegal. And in fact, if you're drinking anything, don't drive. Get Uber, get a cab, get something else, but don't drive. What is binge drinking? Binge drinking is consuming 5 or more drinks in a short time. This is a very serious sign of alcohol abuse, and in teenagers and young adults, this may lead up to about a 10% loss of brain power, especially memory. When adolescents become hooked on alcohol, the effects of the addictive process accelerate considerably. So it is fairly important that if somebody's going to be addicted, and I say that somewhat tongue-in-cheek, it is better that they wait until they're at least into their late 20s or 30s, because you will accelerate the addiction process and lose some brain power as well. What are some treatments for alcohol abuse and dependence? Well, of course, talk about detoxification. That's the withdrawal of a person from alcohol, and it occurs in a medical setting, and it's tightly controlled. And it's often necessary before long-term treatment begins. And it's important because withdrawal from alcohol is one of the most dangerous withdrawals there are. And you think, oh, heroin's got to be worse. No, it's not. It's alcohol. Dangerous seizures can occur in a alcohol detoxification. One of the most publicly aware treatments for alcohol dependence is Alcoholics Anonymous. It's a worldwide health organization, and it's composed of other recovering alcoholics, and it emphasizes this 12-step program. And first step is admitting powerless over alcohol usage and wanting to recover. And I say it's powerlessness because many people who continue to drink and drink and drink, even in the face of it ruining their lives, and they're starting to lose things gradually and gradually and gradually, there seems to be this denial, this delusion that comes over them that they can still control. They can still control this drinking, this excess drinking, which to them isn't really excess, it's something they need. So admitting powerlessness and wanting to recover is really an important first step. This below it is a very common, and it's an excellent, quick way to assess whether or not one is drinking to the point of alcohol addiction, of alcoholism. And that is called the CAGE questionnaire for detecting alcoholism. Have you ever felt you should cut down? Have people annoyed you by criticizing your drinking? Have you felt guilty? And have you ever had a drink first thing in the morning? Eye opener, guilty, annoyed, and cut down. And it says here, total score of 4 is virtually diagnostic for alcoholism. Yeah, think about it. Then we get to hallucinogens. They are substances that alter or distort your sensory impressions, your perception. They don't create it, they distort it. And this is the major difference between something like schizophrenia and taking a hallucinogen. If you give a hallucinogen to somebody with schizophrenia, they'll say, "What is this that you gave me?" So hallucinogens and hallucinogenic drugs do not create the effects of schizophrenia. However, if you go without REM sleep for long enough and or take amphetamines for a very long extended period of time, you will experience a true psychosis. So one of the first hallucinogens is called LSD, which is lysergic ethyl diethylamide, and it can produce hallucinations and other psychotic-like symptoms. Mescaline or peyote comes from this cactus up here. LSD is that little tab. It's very, very, very small, like in micrograms, not even milligrams, micrograms here. So very, very tiny amounts here. Peyote comes from a cactus. And psilocybin comes from mushrooms types, and then PCP is very dangerous, by the way. PCP initially can have hallucinogenic effects and anesthetic effects. It is a stimulant and depressant effects as well. PCP is really angel dust is really a horse tranquilizer, so it is not good, very good. Stay away from it. Then the major so-called hallucinogen, and marijuana is a very, very mild hallucinogen. It is technically cannabis sativa. Where's another one? Indica. Yeah, cannabis indica or cannabis sativa. Marijuana, pot, they're leaves and flowers of the hemp plant. Hashish is the resinous material scraped from the cannabis leaves. The active material is THC, tetrahydrocannabinol, and its effects include relaxation, time distortion, perceptual distortions. Like I said, very mild hallucinogen, time distortion, and perceptual distortions are mild hallucinations. And physiologically and psychologically, they can be addictive a bit. Not as severely as the other drugs, but yet still anything that is taken over and over and over again, even your grandma's chicken soup, can perhaps cause an addiction. What are some health risks using marijuana? It may increase the risk of cancer. Remember, in smoking it, increase of cancer, including prostate, cervical cancer. It can suppress the immune system. And I'm saying all of these things in that there's been tons and tons of research on this, and it is ongoing. I must say this straight out up front, marijuana and the use of marijuana is far less dangerous than the effects of alcohol. That being said, they are still both consciousness-altering drugs. And both have negative effects. Marijuana, depending upon how you take it, can, like I said, increase cancer, suppress immune system. THC can also cause higher rates of miscarriages. If you're pregnant, don't do any drugs anyway. Activity levels in your cerebellum are lower than normal in pot users. Not your cerebrum, your cerebellum. That's your small brain behind it. That coordinates fine motor activity. So, and the activity in the cerebellum are lower in normal pot users, are lower than normal in pot users. And pot also may damage some of the brain's memory centers. You probably heard that as well. And this is all may. Or in other words, there's no the research that's going on, see, yes, it can do this and it can do that. It's like when you're prescribed a drug and you read it and it says, well, this drug can cause this, as reported by 10,000 people who have taken it, and so on. So any of these things can happen. That is it today for Chapter 5, and we're talking about states of consciousness. Thanks for listening.